This is my study on influence of resistance training on health and some selected physical variables among college males. Resistance training is also known as strength or weight training. Resistance training is very beneficial for all athletes. Presently, the demand of resistance training is very high globally due to its remarkable benefits with regard to health and fitness. Strength training programs performed below study environment are excellent for improving muscle force and power. According to American College of Sportsmen in 2009, Kremer and et al. In the year 2004. Bear 2010 reveals that the resistance training serves as the dynamic force for a healthy life and is the key role for improving athletic performance in various sports. Circuit weight training among the different strength training modalities is very effective in enhancing performance in untrained males, Haber et al. In the year 2004. Recent studies had shows that supervised resistance training programs do not appear to have any adverse effects in children and adolescents, Melina 2006. In fact, may improve cardiovascular fitness, body composition, bone mineral density and blood lipid profiles, Benson and et al. In the year Melina 2006. If properly performed, executed, strength training can provide significant functional benefits and improvement in overall health and well-being. Increase bone and muscle, tendon and ligaments, strength and toughness, improve joint function, reduce potential for injury, increase bone density, increase metabolism, improve cardiac function, elevated HDL improves good cholesterol. Resistance training has long been considered an important activity for adults, and the latest physical activity recommendations for youth, adults and older adults now include guidelines for resistance training, U.S. Department of Health and Human Services 2008. The purpose of this study was to find out the influence of resistance training on health and selected physical variables among college males, because our actually we are teaching to the orientation students and college students. So most of them, they are untrained and also they are inactive. So the purpose of the study is how much this, if we are giving any training program, how much it influence on them and how much they are benefited. A group of 30 subjects were selected randomly from this study from the various classes of physical education college course. Each of the subjects were between 19 to 22 years. The training program was employed for 12 weeks. The resistance training, there were 10 exercises was employed on the participants, and the training was for 45 minutes. Weekly 2 days of training, because in our structure we teach the students 2 days, weekly 2 times. Pre and post tests were employed on the subjects for BMI and resting pulse rate, sit-ups, push-ups tests for 30 seconds respectively. As you know, the recommendation by the American College or NSCA 1 minute. But due to we have to see the level of the students, they are untrained. So modified we have given for 30 seconds. The selected exercises for resistance training considered for the study was warm-up, then high pulley, inclined chest press, sitting shoulder press, sitting triceps extensions, and so on. To find out the mean difference from pre to post test, mean and standard deviation and t-tests were computed by means of Statistica software. And this training program from low to high intensity we had given to them. And these you can see very clearly here, for the BMI body mass index, it was an encouraging result. It was 28.68, and in the post it is showing a significant result, 27.43. That means they had lost body weight and their BMI reduces. And resting pulse rate also find encouraging results. And in the sit-ups tests also they have improved a lot. There was a significant performance. and push-up test also they have performed well, but in the sit-ups they have improved better than the push-up test. The analyzing of data reveals that the mean and standard deviation with regard to body mass index, it was 28.68 and 27.43. The resting pulse rate 69.20 and 63.96. And in the sit-ups 19.30, 24.47. And in the push-up stats it was 16.23 and it was 21.93 respectively. 12 weeks of resistance training program have a significant effect in enhancing fitness and health among college males. In the present studies, the selected college male scores were very low in the pre-test. Pertaining to all the selected variables, the study is agreement with the findings of this study Bennett in the year 2012. Investigated that effect of resistance training for 8 weeks had shows reduction in total fat percentage. Resistance training has an indirect effect on body weight and fat loss through increasing resting metabolic rate (RMR) and enhancing fat oxidation, increasing or maintaining muscle mass or fat-free mass, increasing serum catecholamine levels, and enhancing post-exercise utilization of energy are all factors that play a role in the ability of resistance training to increasing RMR. Because resistance training maintains or increase muscle mass even during severe caloric restriction. RMR will remain elevated or will be maintained during weight loss. In addition to increase in RMR, the rate of fat oxidation is affected both acutely and chronically. Jeffrey and et al. In the year 2002. The selected physical variables like strength had also showed significant improvement during the 10 weeks of resistance training program. It was revealed that the children and youth had shown significant improvement in regard to strength, power. This is agreement with Fogborn et al. In the year 1996 and also Tan in the year 1996. This is also evident that the resistance training program, 2 days of training per week, 45 minutes per session, for 12 weeks is also useful in enhancing health and physical performance, because there are a lot of studies are there for 6 days, 4 days, 3 days, but this study also, it is encouraging for 2 days, and but it will be very worthful if we have conducted for 4 days, and also we can do on intermediate level or maybe elite, so it shows how much they can improve, because this was on the untrained students. It is concluded that the influence of resistance training on health, body mass index, resting pulse rate had shows significant performance from pre to post test among the participants. It is also concluded that the influence of resistance training on selected physical variables, sit-ups and push-ups had shows improved performance from pre to post test among the participants, which is significant and encouraging. Thank you very much. If you have any questions,